Evening, everybody. Welcome to the session with the web platform for dialogue. And it's a wonderful opportunity to introduce our today's speaker in the month of September webinar series, Piyali Mitra. She is working as PhD scholar in the Department of Philosophy at University of Calcutta. She has been working religious outlook of human embryonic research. She is also an alumnus of Wolf Institute under University of Cambridge, UK. Her interest lies in understanding how religion can have an impact on human well-being. She has been working on the project on how religion influences human happiness and welfare in collaboration with Council for Research in Values and Philosophy, Washington, D.C., and Kamala Nehru College, University of Delhi, India. A book chapter and conference proceeding based on the mentioned theme is awaiting for publication. She has also undergone training on Hindu ethics and spirituality expressed through the scriptures and the Wellesley College and Harvard University, USA. Through an online program initiative of the Institute, she is in present a sponsored student of the Oxford Centre for Hindu Studies, University of Oxford. She is also working on women empowerment, ethics of care, culture, and other bioethical issues. She is closely associated with the Institute of Medical Ethics, UK, Global Bioethics Initiative, New York, USA, and GBI is affiliated to the United Nations Department of Public Information and obtained special consultative status with the Economic and Social Council, ECOSOC, and she is closely working with Asian Bioethics Association. So I welcome Piyali for today's presentation. It's the greatest opportunity to hear Piyali's presentation because that's very important for nowadays, that how the value-based education and how the ethical importance in our day-to-day life. I welcome Piyali for the wonderful session with her. Now I hand over the session to Piyali, and after Piyali's presentation, I will come back to you, audience, for your question, your observation, and your input. Thank you so much.
Okay, thank you for such a wonderful introduction, and good evening to all of you. Okay, let me now present. Is it now visible? Hello?
No, it's not visible.
It's not visible.
Just do again with the present now.
Is it now?
No. Yes, now it's coming.
Okay.
Yes, now it's
So good
Thank you.
evening once again. Okay. My presentation concerns with it's entitled Dying Well in a Pandemic, Sharing the COVID-19 Experience. So I begin my presentation with the talk that our respect should not only be limited to life, it should also extend to beyond life, that is in the death phase also. So now I introduce the situation, what is meant by dying well, and why I have introduced this dying well in the context of COVID-19 situation. So dying well is an aspiration we all have, irrespective of whether there is outbreak or pandemic or not. The COVID-19 outbreak has changed many things about the way we have lived so long, like maintaining physical distance to curb the spread of the infection. And with the physical distance norm and living in isolation, end of life situations has become all the more complex. So how COVID outbreak of the disease affects life and death. So we can see that the emergent infections like hantavirus, SARS, H1N1, Ebola, Zika, Nipah, and re-emergent infection like tuberculosis have been affecting humanity for the last few decades. But this pandemic has intensified and expanded in terms of its global reach with deep and strong impacts on public physiological and mental health and unprecedented shocks to economies and labor markets. So, what is understood as death in the various traditions? While we talk of death, we start with the Hindu traditions. So, the time after the death or passing away of a person in India is given a lot of importance. As per the Hindu holy scripture, like the Bhagavad Gita, it is believed that the soul of the person who has just passed away is on its way to the next level of existence at such a time. As such, it is within an intention to help the departed soul in a peaceful crossover to that next level of his or her existence, and that Indians observe so many rites and rituals, and one that being the Shraddh ceremony. So basic idea behind the Indians following all this funeral tradition is to show reverence to the deceased person. Normally during this time, all the family members gather, share each other's sorrows and pray so that the soul of the deceased person rests peacefully. Now, what is understood by death in the Christian tradition? Michael Lee, in his article, Christian Beliefs and Religious Practice of Death and Dying, holds that, according to Christianity, each person possesses a soul that leaves a person's body at death and goes to an afterlife in heaven or hell. And the Catholics also believe in the existence of a middle state between heaven and hell, called the purgatory. The heaven is believed to be a gift from God to those who have lived a righteous life. And then there are several religious practices that takes place before and after the death of a Christian to prepare the soul for the afterlife and honor the deceased religious life. The Islamic faith have a unique set of beliefs towards death and dying. This can be seen in their practice and attitudes towards funerals. The whole community participates in a Muslim funeral. It's not unusual for someone to attend the funeral of someone they don't know well. It's comprised of prayers, rituals, and rites, and prayers are recited outside the mosque, normally in the courtyard. So, what Muslims do when someone dies, when a Muslim dies, death is imminent, the whole family and closest friends are there. They believe that the dying see things that the living cannot. They go through an agonizing period called a death struggle, which is filled with unimaginable agonies. Friends and family gather around and offer the dying person courage to help them endure the agonies. They chant and encourage the dying person to say Shahada, meaning that Allah is the only God. The goal is that the person says those words at the exact time of death. So just after the death, the eyes and mouth of the deceased are closed, the body is covered with a sheet, their head is positioned to face Makkah. The family and friends ask Allah to forgive the sins of the departed, which is referred to as dua. So after all this, one question that crops up is, what is actually a good death? And what is really we understand by terming something called a good death? Now, the notion of a good death is still anchored by the image of a deathbed encircled by loved ones. Yet, the diabolic nature of the pandemic is that it has made these mortal gatherings unsafe. So when we talk of death, it itself reflects a loss. And so concept of good death is the one where people's rights or rather dignities are maintained. The journey should be as stress-free as possible and provide people with a hand to hold if that's what is desired. In fact, I post here a scrap of conversation being carried out between my friend and a nurse who has been working in a coronary unit, and her experience has been gathered from the daily work she does with handling the aged patients. And this is what she has said about what she understands by good death. I see a good death as one where the patient can express what they feel, what they fear, where they find peace, and where the family is willing to talk about the journey of death. So now I shift my attention to COVID-19 death in India. So death due to coronavirus in India has indeed become a taboo, and the increasing fears are only an impediment to death with dignity. The World Health Organization and the Indian Health Ministry have laid some guidelines how to manage the bodies of those who have died of COVID-19 and have exclusively mentioned that if health workers, mortuary staff, and those handling the bodies follow some standard protocol, there is no fear of being infected through dead bodies. Who has clearly outlined that cadavers do not transmit disease. And I show you the August chart where it shows that till date 78,000 plus deaths have occurred due to coronavirus. So the guidelines that WHO have laid down on the 24th March interim states that COVID-19 is an acute respiratory disease caused by the virus affecting the lungs. Only the lungs of patients with pandemic influenza, if handled improperly during an autopsy, can be infectious. Otherwise, cadavers do not transmit disease. To date, there is no evidence of a person having become infected from exposure to the bodies of person who died from COVID-19. And this is what is also reflected. The same thought has been reflected by the Government of India, Ministry of Health and Welfare, Director General of Health Services, when they have said that the main driver of transmission of COVID-19 is through droplet. So it is unlikely to be an increased transmission from the dead body to healthy person who follows standard precautionary measures like bathing, kissing, hugging of the dead is not allowed. The ash does not pose any risk and can be collected to perform the last rites. But even after WHO's and Indian Ministry of Health and Family Welfare's guideline on death due to COVID-19 pandemic, some strings of incidents were reported in India, which makes clear that these guidelines are not common knowledge among the general mass because of the failure on the part of the state mechanism to disseminate proper guidance and spread awareness. So because of the failure to communicate and disseminate proper knowledge, incidents were reported, but death with dignity has been denied. I would mention here some incidents, particularly concerning health workers who have been treating COVID-19 patients have been to succumbed to it, and though they were held as frontliners, but denied even a burial, there was no dignity even after death. One such incident is about Dr. Simon Hercules. Now he has been a noted surgeon from Chennai, and after his death due to COVID-19 was deprived of the dignity he really deserved. So proper funeral could not be conducted. What happened is that when he died, he was about to be cremated, but then some angry crowd gathered outside the place where the burial has to be carried, a burial ground. Now the ambulance carrying Dr. Simon have been really been turned away. And then when the ambulance went to another burial ground for cremations, there the crowd started pelting stones and the ambulance, and the window pane of the ambulance got broken, and some of the staff, especially the officials, civic officials, sanitation workers accompanying the dead body, literally had to flee to save themselves for the time being. So now, past midnight, three doctor colleagues of Simon, they decided to dress in PPE and then escorted by police returned to the cemetery to bury the doctor themselves. And they had only one spade among themselves. They had to use bare hands to dig the grave with a constant fear that any time the mobs may be waiting outside the ground to hound upon them. Now, this is not a lone incident. Similar such incidents again occurred one after the another. Another have been reported at happening at Shillong by Dr. J. L. Silo, who has also met with the same entities after his death. So, as per his family's wish, his ash was to be buried at his farmhouse located outside the city. Now, large crowd gathered outside the crematorium, flouting the social distance norm, and didn't allow the official to cremate Dr. John at the chosen place. So, even after the local leaders denied permission to bury his ash at his farmhouse on the basis that he was not the permanent resident of the area where his farmhouse is located. So ultimately, he was hearsed in a church cemetery close to his hospital, which he has himself built. Can be seen that these incidents cut across various religions and people of various creed of India were denied the minimum respect or dignity. Only with lots of negotiations with the local authority, burials and crematoriums were made possible during the initial months of corona infection in India. Later, with the interference of government, separate burial grounds and crematoriums are now allotted for COVID-19 deaths, which are situated far away from the main city and villages. So we need not only death with dignity, but also a proper end of life care facilities. Well, after citing all those negative instances now, I would like to state some of the positive instances also. One such being that what the Khetra Bajaja Committee of Agra has been doing, especially during the COVID months. What they have done is that this Khetra Bajaja Committee of Agra has been known for conducting the last rites of people who lost their lives and the bodies remained unclaimed. With passing time, that role changed to performing the last rites of people who remained unclaimed. Amid this pandemic ravaged times, the organization continues to serve the city quietly and selflessly to grant dignity to the dead. For 3 years, urns containing the ashes of the unknown are preserved with the organization before they are immersed in the Ganga near Kashganj. Even for COVID-19 fatalities, Khetra Bajaja retains the ash for the dead so that if a bereaved next of kin turns up, they may be handed over the ash to their loved ones. So also, I'd like to state a story about a true story about a man named Michael who has been living or who is still living in Orissa Puri city. So Ashok Shah, popularly known as Michael, who has been collecting unclaimed and abandoned dead bodies and performing their last rites. Now, this pilgrim city or town of Puri is also a very, can you all are aware of, are destitutes or beggars and a home for the those who are homeless and people afflicted with leprosy. So there are daily incidents of homeless dying on the streets. Michael was unofficially asked by the inspector in charge of Puri to collect the unclaimed bodies for autopsy before disposal. Michael not only collected the bodies, but he started performing the last rites of the unclaimed bodies. To Michael personally, every dead, even if unclaimed or abandoned, deserves proper last rites. Instead of showing some repulsion, what he does everything to ensure a dignified funeral to every bodies, and he continued this great service even in the times of COVID-19 pandemic. He treats the body the same way a family member or a relative would. I state here also another instance of how the people of Kashmir are also coming up to provide death with dignity. So it happened like this, that when an elderly person died due to coronavirus after being admitted in a hospital for 15 days in North Kashmir of Baramulla district, a grave was dug at his ancestral graveyard and kept ready for his burial. After the family waited for hours at the graveyard, they were told by some officials that to bury him at another place instead of their ancestral graveyard. And when the few relatives and families of the dead reached there, they were denied burial in the graveyard. Almost everywhere, people are raising objections and do not want COVID victims to be buried. In such a scenario, what happened that a group of volunteers led by Sajad Ahmed Khan, who is a local grocery store keeper, decided to form 5 groups consisting of 4 people in each group, and they have helped in burying people following necessary protections. They have also worked together with the physicians, local physicians, and what happens that when one group comes forward to help people, after the help, they go for 14 days quarantine. In that period, in that interval, another group come forward to help. So in this way, things have been carried out and the process is going on. So they are helping the dead to get proper burial with respect and helping people to overcome stigma related with death due to COVID-19. In fact, they have opened some sites at Facebook and other social media so as to make people aware that death due to COVID-19 The stigma related to death due to COVID-19 should be shunned at every level. So now, in such a context, what's most important? Whether the non-medical intervention or the medical intervention, whether it is quality of life should weigh over the quantity of life, or the outcomes has greater importance than the treatments. So while talking of the non-medical getting more attention to the medical intervention, or is it that both should be taken care of? I here now state here that public health management strategy response preparedness plan like Ministry of Health and Family Welfare announced free testing and treatment of COVID under Ayush Bharat, announcing additional insurance cover for healthcare and sanitation workers. Certain emergency relief were announced by the government promising fund immediate supply needs, and they all come under non-medical interventions. In fact, the governments at state have collaborated with private bodies and academia to use information and communication technology, artificial intelligence, big data analytics for efficient risk triage, contact tracing, geofencing, that is uh, locating some places at red zone, green zone, and yellow zone, and then distributing the treatment accordingly. And then some quarantine management of the suspects, like Tamil Nadu's COVID-19 quarantine monitor, Maharashtra's Mahakavach chat box in 24 into 7 command and call centers, among many solutions. In a bid to contain the COVID-19 pandemic, West Bengal and its government has also set up a unique COVID warrior club comprising of people who have recovered from the disease and are willing to aid the administration and health workers in containing the pandemic. In fact, I would also like to state that in order to decide whether the significance of quality of life should weigh over the quantity of life, we need to understand what is understood by quality of life, and I'll discuss it in my later talk. In any disease, I think the outcomes also always has a long-lasting effect than the treatment alone. There may be various potential therapies, but the effectiveness needs to be tested and tried. We may review selected repurposed and investigational drugs and employ them for treatment depending upon the effectiveness. Meta-analyses have shown that patient-informed preference and choice may affect treatment satisfaction, completion, and clinical outcome. So what is quality of life? Quality of life is a dynamic synergy between the external factors comprising an individual's life and the internal perceptions, and this forms a significant component in healthcare setting. Who defines it as an individual's perspective of life in the context of culture and value systems in which one sustain in relation with the aims, standards, expectations, and concerns. So what are some of the traits that characterize quality of life, like livability of the environment, liveability of the individual, external utility of life, inner appreciation of life. And to develop this ambience, we need common sense, be good at what we work at, education, and learning. So while speaking of the quality of life in the context of end of life care, I bring into discussion the palliative care, a concept emerging in the world of medicine and social care as an approach that improves the quality of life of patients and the families facing life-threatening illness through the prevention and investigation required to better manage distressing clinical complications. Palliative care uses a team approach to address the needs of patients and their families, including bereavement counseling. This integrates the psychological, physical, and spiritual aspects of patient care. With the advanced directives in motion, we may be able to withhold life support or available but considered to be disproportionate, withdrawing life support, full care but no cardiopulmonary resuscitation, full care including cardiopulmonary resuscitation. And in those countries where there may be no advanced directives like what we have in India and the other South Asian countries, we can do so with the consent of the caregivers or the next of kin of the patients. With their directive, with their advice or with their suggestions, the physician can do the following things. In fact, in the COVID-19 scenario, palliative care professionals are attempting to guide non-palliative care colleagues about providing holistic care to serious COVID-19 patients. So in case of ill responses to intensive care, there may be provisions for non-escalation of treatment achieved by a preemptive discussion of goals of care and advanced care planning with communication, a medical facility and documentation. A psychosocial and spiritual support for the COVID-19 patient is required. Of course, we have to take into consideration the availability of limited resources and fund. And the disease containment measures can further worsen the sense of isolation. So this needs to be identified and addressed as a component of whole person care. We can do our best to see our loved ones have the best possible end of life care. We can also remain in contact with those needing care with even a phone call. Even if the resident or hospital patient is unconscious, they can be facilitated uh, by staff, nurses, or social care workers. And with the help of healthcare workers and technology, loved ones have been able to say goodbye from a distance. So, the use of technology, some families are able to communicate with the loved one during the final hours, while others take comfort in knowing that the loved one is accompanied by an extraordinary healthcare worker who will sit with them until the end. For many, this helps us to change the landscape of dying alone. So, like the Mysore District Administration of Karnataka has set up a televerification and communication team for COVID-19 patients with the special task of monitoring the health of Mysore City Corporation employees' well-being. In fact, as I've said, that some of the non-medical interventions like includes closure, physical distance, shielding of older people, self-isolation, symptomatic individuals, and a combination of other steps. So, what is needed is we should need to honor and love the departed soul, for the departed will remain deeply ingrained in our very heart. Thank you. Namaskar.
Wonderful presentation. Thank you so much, Piyali, and it's actually very timely presentation because it's a very contemporary issues that we can able to witness so many deaths due to COVID. But how about the dignity, the right after death? We always struggle that who right means right to live, but you actually explained a wonderful explanation that right after death also an individual is going to be departed from departed soul, but the body is left. So what about the body? As an individual, I think it's very important to pay that much dignity to the departed soul as well as to the body. It's not in our hand that which infection we will have. It's very unfortunate that we are going to see so many deaths due to COVID. But initial stage, as you rightly pointed out with the doctor in Chennai, that was really a you know really great shock for me when I actually first heard the issue, that who have served his entire life for the humanity, for the biggest cause of human beings. Even after his death, he's not able to get, I know, the right of the dignity, and it's very unfortunate event. Not as a Christian, not as a Hindu, not as a Muslim, but as an individual. So I deeply felt for the persons. But I think after 5 months over COVID, with when we are actually living with COVID, now we can able to see in a very different way, philosophically, scientifically, and sociologically. We are in a phase of accepting COVID, and we have to live with COVID. That is very obvious. Until and unless any kind of miracle will happen, because even with the scientifically also, I'm not very much sure that when the vaccination will come and it will be actually omitted entirely from the society. So it's very obvious. So a wonderful presentation, first of all. Please have my gratitude for your presentation. And
Thank you.
now I am opening the floor for the discussions, for the questions. For those, he is from Kashmir, and he's a wonderful person doing PhD in, I think, Agra. So he can point out some of the explanation from your case study that you pointed out on Kashmir issues. and Kashmir case study. So for those, I am coming back to you. Would you like to comment on that, or if you have any observation on that particular case?
Hello,
Yes,
am I audible?
yes, you're audible.
Yeah, actually, my question is about the violations after the death. If a person dies, so my question is who is responsible that if a person dies and there are violations against his dead body. And the second question of mine is that in Kashmir we are having the situation different of the rest of the country. We are having here Army Special Power Act. It is a act under which army is having full-fledged rights. So recently, what happened in Kashmir? There happened one fake encounter under which three laborers have been killed under that Army Special Power Act by the army. Now what happened? The families have asked for justice and they have filed the case, but they have not still given the bodies of their sons, and government is denying them that because of COVID-19 we cannot hand over the bodies. There are so many stories like this. So my
Thank you.
only question is
Yes,
that who is responsible
yes,
and how we can overcome these such problems. Thank you very much.
yes,
Okay.
Piyali.
Okay, the overnight solution cannot be found for this problem, but one thing can happen, that there should be a constant communication, interaction, face to face, or if not face to face, the communication should go on between the victim as well as uh, the government or the state mechanism. And the state mechanism is actually responsible for disseminating proper guidance as well as knowledge. On the failure of the state mechanism, such kind of stigma do happen. And also people should be made aware that death due to COVID is not should be taken no should not be taken or should not be branded as a taboo or a stigma. There is nothing very harmful like that. Yes, there are chances of infection, but if proper guidance are taken care of, if the state helps, if the health worker helps, then people should come forward to bury the death. Number one. In case of fake encounter, I'm not quite in a proper position to comment on that, but still since the families are not being given the body because of the COVID pandemic situation, I think there must be some kind of as I said, the communication should go on so that the family may be handed over with the bodies. And if the family is not handed over, at least the state should take the responsibility for a proper burial of the bodies. They should be given the proper respect and dignity to the bodies. That is what I feel.
Thank you so much. Rightly pointed out that proper burial, proper respect and dignity should be given. So that's the important aspect, philosophically, humanitarian way, and with a sociological aspect. Thank you so much, Piyali. You have pointed out the right answer to for those. Thank you for those for your question. I think Piyali answered it very well. So I have some more minutes left. I'm coming back to Piyali's presentation. Piyali, if you like to explain in a different way, in a different angle of your presentation, you have some more minutes left. So if you want to describe that the Indian concept of dying and the Western concept, if you just point out the comparative analysis in front of us, if you have.
Okay, we in India believe in the transmigration of the soul. That is our after death, the body may get demolished, but the soul that continues to live, and it just takes up another form. So with death, we consider death as an embodied. That is, it continues living. It continues. It doesn't die. Whereas in the West, what happens with death? The body and the soul get demolished. So there is the end of the life. And that is one of the most important difference between how we see death and how they see death. That is the reason we should accord more respect to the death, because only the body gets demolished after burying or after the cremation, but the soul continues to live. And if the soul lives, that is, we are still living. We should be given dignity. We should not just view it as a carcass and just throw it away like anything. Whereas even in the West, they do also give importance that the Catholic Christians believes in also in the transmigration, but unlike us, especially the non-Abrahamic religion, mainly, if I not take into consideration the I will say the South Asian culture mainly believes that with the death, the soul doesn't end. It goes on, it takes another form and goes on living and living. Thank you.
So much. You have rightly pointed out between the differences of Abrahamic and non-Abrahamic religious concept. Because as a Hindu, Hinduism, it's not a religion; it's a cultural embodiment and cultural journey from our childhood. That how we actually believe in Hinduism. Though Hinduism have different branches and different understanding, different angles, but I personally, as a Hindu, would like to see Hinduism as my regular regular prayer and regular. Uh, it's more like a regularity in my spiritual way. I'm not regularly visit temples, but I more believe on the humanitarian aspect. Irrespective of any religion, irrespective of any culture, I think if we should give minimum respect as a human being, that's the essence of the religion, whatever I feel as a Hindu. So I'm coming back to Piyali that what differences you can point it out that after COVID scenario, uh, what is your opinion in the West Bengal scenario? I think you can also able to see different clippings in the videos that the dead bodies have been dragged very brutally from the mugs, and so what were your point of view into this, that unclaimed bodies have not been given proper respect, proper dignity after death due to COVID? So the government should be very sensitive in this way. That what's your point of view, please?
Yes, of course, the government should be most responsible. In fact, without proper guidance from the government, state people cannot really move. On top of that, people also should understand and should be aware and should be literate to understand that dying doesn't alone leads to infection. That is the main thing. So we should be aware of that first. So we should be scientifically aware. That is most important. We should be logical. We should not just be emotional, and we should not be unduly be afraid of something because it's a COVID, it's a leprosy, it's so and so. It should not be taken as one thing untouchable, because we have an untouchable problem in our culture. On top of that, COVID seems to become another untouchable, but that should not be so. And because of these stigmas and because of so much taboos, we are just making death more complicated. And so we are denying the respect that the death should also be given too. So I think that a preparedness plan should be charted out by the government of Bengal. In fact, every government should chart out some kind of preparedness plan, that if any kind of pandemic in future, if it, God forbids, if it breaks out, what should be the step of action be taken, how they should move, and where should be the burial ground, what are the ways they can move so that undue complications cannot crop up. and the family should not face any kind, because death itself is a loss. The families have to go so many emotional trauma. On top of that, if they have to face this kind of taboos and stigmas, this is only burdening upon them. And so if there is a proper preparedness plan, as we are having in other countries, if we have such kind of plans, I think that the death will properly be given the dignity that they really deserve.
Wonderful. Thank you so much, Piyali. Thank you. We have another question from Firdaus. What are the unanimously ways from all religions after following rituals after death of a person?
Yes, of course. After following different rites and rituals, what is most important is respect. That is what is I am highlighting every time. That is, we should give the respect. Respect doesn't end with life. It should transcends to even to death, irrespective of any religion, any culture, any country, any region. That is what is what I wanted to say.
Thank you, Piyali. Yes, that's what we always try to emphasize, that respect should be there. I think even with the misunderstanding, with so many misinformation have been spreading out initially, but I think after 5 months, now government is following certain rules and regulations unanimously for the COVID dying patients. So I think now the situation is more or less under control
Yes.
because of the unpreparedness, because of the, they are not ready at all. So I think the readiness and the preparedness should be always there. That's why we always believe that precautions is very, very important. So prevention is better than cure. So that's what we always think in our mind, that how in our culture, in our tradition, in whatever religious beliefs we are in, we always need to follow certain rules and regulations, and the government always try to respect each and every religious beliefs, each and every culture. In that way they can easily move on uh, with their journey of their uh, authoritarianism. Because what government is doing initially, they don't have any kind of written material how to do COVID, how to deal with the COVID patient, how to deal with the dying patient. So that's why some kind of issues have been happening. But now I'm sure that in future, if we will have some issues, I think government now have certain rules and regulations, right, Piyali?
Yes, of course, and of course, we as citizen of a country, we should be also be made aware how things should move. That is also, there should be a management or awareness, and yes, we should stay away from fake news and all those cropping up. So we should be aware, logically, rationally think how things should take done. It is also a responsibility.
Thank you so much. Thank you, Piyali. There is a request from both the from Firdaus and from Swastika. Please write your email address to them, so they will get back to you. So write in the chat box your email ID, please. So Swastika, do you have any question to Piyali? You can ask.
Thank you so much, ma'am, for this engaging lecture. Wonderful. Uh, yeah, that's it. Thank you so
No,
much.
if you like, you can ask your question in Bengali also. We don't mind.
No, actually, I don't have any question to ask, but
Okay.
I
Okay.
really appreciate your lecture. Thank you so much.
Thank you.
Okay. Okay, Swastika. Thank you so much. So we are almost at the end of our discussions, and it was really fruitful discussions from the perspective of Hinduism and from the other religions as well, because you have pointed out very clearly from the Christian background and from the Islam also. I would like to know if you just point out the Parsi, the Parsi religion, that they believe that after death, their body should be given to the animals, so the animals can have the body, and it would be the greatest opportunity for them. What would be your opinion on that?
Actually, Percy's belief oneness with nature. That is the reason why they think that after the death, the animal should eat upon the body. That's why they think that we are not different from nature. We are part of the nature, the greater nature, and that's why with death we become again one with the nature. So we don't need different burial rituals and like that. What is happening that the animal should eat upon it as the food, and our body should also be useful those who are non-human too. So that is the reason why they think that we as a whole, we are one with the greater cosmic whole.
Wonderful. Why I'm pointing out this? We have so many misconceptions. We have so many myth. We have so many beliefs. So that's why I'm pointing out, because India as a pluralist society, where we have lots of religion, lots of culture, variety, and I think that's the essence of India, that we have the variety, university in diversity, unity in diversity, and this unity, we have to move on with this diversity. Irrespective of any governmental political thought or anything, we have to be united, and that's why I think the platform for dialogue is trying to do that. That irrespective of any religious beliefs, any cultural beliefs, we are here to, here to listen from the expert like you, because you know very well about the religious and the ethical concept of all the religious, because you are from philosophy department of University of Calcutta. So we are almost at the end of the discussions, but this discussions is endless, because we have lots of things to hear from you. And it's my personal gratitude to you that you accept my invitation to speak on the timely, very, very timely presentation on this particular topic. So thank you so much, Piyali, for delivering the wonderful session with us.
Thank you so much for also giving me the opportunity to express my views and sharing with you all. Okay.
Thank you so much to all the participants over here for your patience. And I hope that we will have another session with Piyali very soon. Thank you so much. Have a wonderful evening, all of you.
Thank you.
Bye-bye.
Bye bye.